morning, Mrs. Jones.
Hi, good morning.
Hi, my name's Emily. Nice to meet you too. I'm a student occupational therapist at the University of St. Augustine. How are you feeling today?
I'm okay.
You're okay? Okay. Well, I see you suffered a stroke on the right side of your brain. So this has left you with your left arm being very difficult to use like you normally would. And this occurred during a coronary bypass surgery about 7 days ago? Okay. Well, Mrs. Jones, your doctor has ordered an OT evaluation so we can address these symptoms that are keeping you from doing the things that you need to do and things that you want to do, okay? Okay, great. So I see you have some sternal precautions. Are you aware of what these precautions are?
They told me, but I don't really remember.
So you were told, but you don't remember. Okay. Well, those sternal precautions are, let me remind you, no lifting more than 8 pounds, so no lifting objects that are weighed more than 8 pounds. No pushing or pulling yourself in and out of bed or transitioning from the bed to a chair or a wheelchair. You'll need assistance when doing these motions. And you cannot lift your arm past 90 degrees, which is here and which is here. Okay, so no excessive shoulder lifting. I see, do you understand?
Yes.
Okay, great. And due to some swallowing issues you are experiencing, you are on a nectar consistency liquid diet. Is this correct?
Yes.
Okay. And I see here you also have suffered from orthostatic hypotension. Now, do you ever feel dizzy or lightheaded?
I get lightheaded.
You get lightheaded a lot? Okay, so that's very common, especially after the type of coronary bypass graft surgery you've had. You may feel dizzy or lightheaded, especially when changing from a lying down position to either sitting in or standing. You may also experience a drop in blood pressure, which could then potentially allow you to faint. We don't want this, so make sure when you're making these transitions, you take it slow, you take breaks and pauses, you use your call bell if you need assistance to call a nurse, but just remember to take it slow. So throughout today's evaluation, if you're ever feeling lightheaded or dizzy, or pain, or you feel that as though you're going to faint, then please let me know and we'll take a break, okay? Great. Do you have any questions?
No.
So far? Okay, great. So your social history here on the chart indicates that you live with your spouse and your small terrier dog? Great. And you live on the first floor of your condo?
Yes.
Great, so no entry-level steps? Okay. Is your spouse home during the day or evening? So when you're discharged, will he be there to help assist you around the house? Wonderful. During the night and day?
Yes.
Okay. And is your condo 1 story or 2 stories?
1.
1? Okay, so no stairs inside the condo? And no issues accessing the bathroom?
No.
Wonderful. Okay, so now we're going to start the evaluation portion of our session. I'm going to just ask you some questions. We're going to do some movements. I'm going to assess your strength, your pain. We're going to see how ready you are for different types of transfers. I'm going to look at your eyes to see how your vision and if it's been impacted by your stroke. And again, remember your sternal precautions. Remember to take it slow so you don't feel dizzy or lightheaded. And stay in open communication with me, okay? Okay, great. So my first question, pain. So right now, currently, what pain are you experiencing on a scale from 0 to 10, 10 being no pain at all, 0 being no pain at all, and 10 being the worst possible pain?
I would say maybe a 7.
Okay, so currently your pain is a 7, so pretty moderate. The best pain you experience on a good day?
A 6.
A 6 as best pain, okay, and then the worst pain you experience?
A 9.
A 9, okay. So now I'm going to take these averages, and then that'll give me an indication as to how severe or intense your pain is throughout a 24-hour period, okay? And I'll get back to you with those results. So now we're going to do some functional range of motion testing, just so I can see how your shoulders, your elbows, and your hands are functioning after your coronary bypass surgery. So I'm going to need you to sit up, please, and how we're going to do this is I want you to use your elbows to help push you to a somewhat seated up position, and then I'm going to help you sit up fully. Okay, so remember to take it slow. If you feel dizzy, let me know, okay? Okay, great. So go ahead and get your elbows ready in position. Good, how do you feel?
Good.
Very good. Now we're going to go Push yourself all the way up. 1, 2, 3. All right. And now use your unaffected side, your right side, to help swing you around. Very good. And the bed is locked. So some functional range of motion exercises I want to work with you. Can you shrug your shoulders for me? One more time, please. Okay, so this was a little difficult for you. Was it painful?
Not too much.
Not too much, just hard for you to move. Okay. And now we're going to look at your shoulder. So can you lift your, now keeping those sternal precautions in mind, can you lift your arms up and then bring your chin down to your chest and, wash your hair for me? Okay, so we can't move that left arm behind your head to shower, okay? Or wash your hair, okay. And then elbow, can you lift your elbow up and down for me? Your arm, your forearm. Very good. Okay, can you do them both at the same time? Okay, so your right arm's great, and then we're having some issues with your left arm, okay? And that's due to the hemiparesis. You may be experiencing some numbness, some tingling, lack of function, lack of sensation, and that's why I'm here today. So forearm, can you, in both arms, slightly elevate your wrist and then pretend that you're turning a key for me to open up a door? Okay, and that's as far as you can go with your left hand?
Yes.
Okay, thank you. You can relax. And then, can you go ahead and squeeze my fingers? Okay. Can you squeeze them up here? Okay, so we can't lift our arm too much, and this was pretty weak, your left arm. Okay, and then can you do this movement for me with your fingers? Both? Okay, so your right arm seems to be just fine. It's your left arm that seems to be pretty weak. And do you find it difficult to wash your hair, brush your teeth?
Yes.
Use it to do, your chart indicates you're an electrician, so obviously your occupation has been greatly impacted. So we're going to work on that as well, okay?
I'm not allowed to go to work until.
You're not allowed to go to work. Okay. Well, that's why we're here. We're here to help you, and we'll get you on a great continuum plan of care, so we can get you back working. So we usually, during the occupational therapy evaluation, we do a manual muscle test. However, because of your diagnosis, we do not manual muscle test for patients that have suffered a stroke and or traumatic brain injuries, or have suffered a traumatic brain injury. Your muscles will not give us an accurate reading, so we are not going to manual muscle test you today. I am now going to ask you just a few questions. So in regards to your ADLs, which are your activities of daily living, and I just need you to answer these simple self-care daily questions for me, okay? So how much from another person, so your spouse, do you need, whether it being a total, a lot, a little, or none, putting on and taking off regular lower body clothing?
A lot.
A lot, okay. So your husband helps you a lot with taking off lower body clothing? Very good. Okay, so bathing, washing, rinsing, drying your hair?
A lot.
A lot, okay. So toileting, such as with a toilet, bedpan, or urinal?
A lot.
You get a lot of assistance, okay. Putting on and taking off regular upper body clothing?
A lot.
A lot, okay. Is it because of that?
Yeah.
It's just completely
It's just
off-balanced?
Yeah, because it's really weak, and then sometimes I have pain in my chest.
Yeah, and you can't bend over to put on your lower body clothing? Okay. Taking care of personal grooming, such as brushing your teeth?
A little bit.
A little bit, so why so? Can you?
I'm right-hand dominant.
Oh, you're right-handed
So I can
dominant.
brush my teeth with my right hand.
Wonderful, okay. And what about eating meals?
Also a little bit, because again, I get to use my right hand.
Okay, very good. Almost done with this questionnaire. Now, how much difficulty do you currently have? And you're going to answer this unable, a lot, a little, or none. Turning over in bed?
A little bit.
A little bit, okay. Sitting down and or standing up from a chair?
A little bit.
A little bit. And then moving from lying on back to sitting on the bed.
A little bit.
A little bit, just to help with your balance and just to have, do you feel a bit more comfortable having someone there close to you?
Yes, because I get dizzy.
Yes, you get dizzy. Okay, very good. And how much help from another person do you currently need? Same scale, total, a lot, a little, or none. Moving to and from a bed to a chair.
A little bit help.
A little bit. Or your wheelchair. I know here you have wheelchair when you're needing to get in and out, or transfer to the bathroom right over there. So need to walk in a hospital room. How much assistance do you need?
Just a little bit.
Just a little bit. And climbing a 3 to 5 steps
A little bit.
with the railing?
Yes.